Hello, my name is Jada Allen, and I'll be doing a presentation on how to use an AED, otherwise known as an automatic defibrillator. Well, what's first? Well, first thing you have to do is make sure that your scene is safe. Make sure that if you have a first aid kit around, make sure that you're wearing your PPE, and that includes gloves. Check for responsiveness. Call out to them if you know their name, say their name. Tap on their shoulder. Look for movement, and make sure you're listening to see if they're making any noises. If not, call out to a bystander directly and tell them to go get the AED and or call 911. What you now have to do is check their breathing. Check their breathing by looking to see if their chest is rising up and down. Make sure you're checking their pulse as well. Check their pulse by looking into their neck like this, feeling for the carotid pulse for a maximum of 10 seconds. So, as you start CPR, position yourself to the side of the patient and begin delivering the initial compressions, which is 30. Make sure the patient is lying flat on a hard surface. Make sure that when you press down, you're in the center of their, in between their breast, on the lower part of their sternum. Make sure you're directly over them with your arms out straight and your elbows locked. Make sure that one hand is placed over the other, and make sure that when you're doing your compressions that they are hard and fast, and you want to make sure that they're at least 2 inches deep with a rate of 100 or 120 per minute. At the end of each compression, make sure that you're allowing the chest to recoil correctly, and each cycle is 30 compressions. After the first cycle, you want to complete your first 2 initial breaths. Using a mouth-to-mask device, place it on your patient's face, connecting it with the bridge of the nose and guiding it to the correct position. Seal the patient's face with your hand. Seal the mask to the patient's face with your hand, and place an index finger and your thumb along the edge of the mask to secure it. Secure the bottom of the mask as well by using your thumb of your second hand. During your breaths, you want to make sure that you're placing the remainder of your fingers of your second hand along the jaw and to help lift the jaw to make sure you're breathing into them correctly. Push with this hand on their patient's forehead to stabilize the head and to prevent movement. While lifting the jaw, press firmly on the outside of the mask to seal the mask onto your face and to avoid air exiting the mouth. Deliver at least 2 breaths over 1 second and make sure to see if the chest is rising. You will continue your cycle of 30 compressions to each 2 breaths with minimal interruptions as possible until that second person that you called out in the beginning returns with an AED, and you will continue to do your compressions and your breaths as they get the machine prepared. When your second person or rescuer arrives with the AED, make sure the AED is turned on. Place the AED pads correctly on the patient's bare chest, which is their upper right chest and their lower left torso. Make sure the pads are placed correctly on a dry chest, and that the AED electrodes are connected to the device. Instruct anyone surrounding the patient to stand clear. That means step back and to not touch the patient. When the AED begins to analyze, you want to make sure that no one's near, so that it gets a correct evaluation of the heart's rhythm. When the AED, if the AED decides that a shock is necessary, you want to again make sure everyone is stand back and clear, and to press the button to deliver the shock. Now, a bag to mask ventilation is a way to ensure that your patient is still breathing during their CPR compressions. You attach what is known as an EC clamp technique to the bag and tilt the head correctly to ensure that the bag mask ventilation will work properly. Place the mask on the patient's face with the bridge of the nose, and again guide it to the correct position. Using your thumb and your index finger of one hand, make sure you're making a C shape of the mask and pressing the mask to the face. This is again to make sure that air is not escaping. Use the remaining 3 fingers that you have to form an E, which opens the airway, and press the face to the mask. So, how do you use this bag mask ventilation? You squeeze the bag to give 2 breaths after every 30 compressions each second. Respond, if necessary, to another rescuer's call to switch roles after every 5 cycles. This is to ensure that no one gets too tired to continue. Perform chest compressions as necessary with a ratio of 30 compressions to 2 breaths. To end, make sure you're maintaining verbal and nonverbal communication with both your victim or your patient and the other personnel surrounding you. Once the EMTs arrive, make sure you give all relevant patient information, such as when did they collapse, when did you start CPR. Remove any gloves you have and throw them away. This is to ensure that if anybody has any contagious diseases, that is not spread. Dispose of that in a biohazard bag. All right, that is it. Thank you for your time.